Welcome back, friends. It's so important to know that when it comes to HIV, there are ways to prevent infection, and it can be as simple as taking a pill or getting an injection. Today, we're learning more about the options out there, especially for those who are the most vulnerable. Joining now are Jasmine Davis, co-investigator at T'Cher, and peer navigator Sailor Payne. Welcome.
Hi, thanks for having us again.
Thanks so much for coming on. Really enjoyed our interview last time. It was so important. So we are back again for another important conversation.
Yes.
And like I mentioned off the top, Sailor, we're talking about the most vulnerable to HIV. Who are the most vulnerable to the infection?
I mean, really everybody. Anyone can get HIV. It doesn't matter if you're gay, trans, any color you are, everyone, if you're straight, everyone can get HIV, you know? So, you know, it's just, it can affect everybody. Our study is specifically for trans people, but, you know, we do want to get out there that anyone can get HIV and anyone can get on PrEP to prevent HIV also.
It's so true, and you just alluded to the study that you all are going to be doing. You have until January 31st. Explain a little bit more about this study, Jasmine, and why you all wanted to do this specific study.
Because it's proven in some research studies that we've done in the past that, you know, women of trans experience are most disproportionate due to lifestyles. I'm not going to say every trans woman, you know, has a difficult life or obstacles or barriers within their life, but we don't have resources that are available to us, you know, that can help with the support and education that we need in order to take charge of our health.
It's so true. So this study that you all are doing, you're asking people to enroll, and what are you trying to learn from this study?
That it takes more than just a doctor's appointment or the reason why you missed a doctor's appointment. Life happens, and so that's why it's important to address a lot of social determinants of health. You know, I mean, transportation can determine someone's going to the doctor or, you know, missing an appointment or not having enough food in order to take your medication. Or if you're having issues with housing, discrimination, or even being criminalized. A lot of people don't have that person or that avenue to go to talk about whatever it is.
And how are you supposed to know what you need if there hasn't been studies done and different historical things that have been learned in order to learn what is needed? So I think it's so great that you all are doing this study right now. But let's talk about PrEP now. You know, Sailor alluded to it earlier that one way to prevent HIV is to get on PrEP. PrEP is for everyone, okay? I don't know if you all are watching the new season of RuPaul's Drag Race, but I see a PrEP commercial every single commercial. Great. Okay, yes. Because it's so important. Let's talk a little bit more about what PrEP is and how people can utilize it.
PrEP is just another tool of prevention. That's all it is. And that it first came in pill form, now it's in injection form, and it actually is another resource for someone. If it's for you, and PrEP can be for you, and it can't be for you. That's why it's important to consult your physician or your healthcare provider, and on any medications that you decide to take. But for one thing for sure is that PrEP, the pill is 99.5% effective, and the injection is 99.9% effective.
And is the injection a one-time thing, or is it like a daily thing?
Injection is once a month. They have the every 2 months, and now they're coming out with a every 6 month injection.
Yeah, like twice a year.
Yeah.
It's so exciting because then you don't have to worry about taking a pill every day.
Yeah, exactly.
Because with PrEP, with a pill, you take it every day. You know?
Yes, you do.
So some that doesn't work with everybody's schedule, you know, with everything. So the injectable is great.
And that's what's so great about T'Cher. Yes, you all are doing this study to hopefully learn more about the trans experience. That's who you all are looking for to be a part of the study. But T'Cher, as an organization, you all do stuff all year round. You're a peer navigator. Sailor, tell us a little bit more about the work that you all do for people who need the help.
The nice thing, we used to be T'Cher NOLA, so we used to only be in New Orleans, but now we're T'Cher Louisiana.
Come on, statewide.
So we're statewide. So, you know, if you're of the trans experience in Lafayette or Monroe or anywhere around there, we can accommodate to you because we have virtual meetings and we have different healthcare organizations around the state that help us out with that too.
We have bases around the state of Louisiana. Places like Acadiana Cares in Lafayette. Also the Philadelphia Center in Shreveport are one of the base places that help us connect with those community members that may be interested in the study. So it's statewide. We go out in community. We have a fabulous CAB that we have our regular meetings with. So that's a community advisory board. to where we get suggestions on how do we engage in community or do what we call outreach. We collaborate and participate in other or with organizations that do things around the community, like events and stuff like that.
I love your passion for this. And it's so important because, listen, you may be watching this right now and you're not of the trans experience, but everyone knows somebody of the trans experience. If you don't, you should, because you all are fabulous.
Thank you.
And they are people too. So I think it's so important that people understand that there are resources and there is community available for people who are a part of the community.
Totally.
Okay?
Yes.
Thank y'all so much for coming back.
Thank
I
you.
love y'all.
Appreciate
Congratulations
it.
on everything. And
Thank
listen,
you.
we've got a special offer for our Great Day viewers. If you are eligible for the study, remember they're looking for people of the trans experience, and you let T'Cher know that you watched the segment. When you successfully enroll, you get a bonus $50 Visa gift card. Okay,
Yes.
but you have to enroll before January 31st.
And I will say one more thing too is if you also know anyone of the trans experience, and you don't have to be trans, you can be anybody, but if you know someone who would be interested in joining our study, you can refer them and get a $50 referral for each referral. So
Everybody
can help
wins.
T'Cher, yes.
Come on. Well,
Does
look,
not
for more
matter.
information about this study and for more information about T'Cher, log on to t'cherlouisiana.com or call 504-894-2738. We'll be right back.